Today is 8th of August 2019 and this is a 4 years old female in Dachshund.
Okay. Now, this Dachshund came in with a lump on this elbow area, the left elbow. According to the owner, she doesn't know whether this lump has been present for how long. If it's only for one day, for a few days, then it will be a serious sign of cancer, because normally if it's non-cancerous, it won't grow so big. It's about 1 centimeter times 1 centimeter times 0.8 centimeter. If it's been there for a long time, that means it could be a leak granuloma. That means the dog has been licking it, causing it to swell and become a lump. But since the owner doesn't know, so she has to decide whether we can do a biopsy. That means we take a tissue, or fine needle aspiration to check whether the cells is cancerous or not. There's one option, a biopsy or fine needle aspiration. Then the second option is, I can give, if it's a granuloma due to inflammation, I can give injection of steroid into the lump and bandage it up, and 1 month later this swelling will disappear, because it is due to inflammation, due to leaking. Now the third option is to operate and remove this lump and send it for histopathology. So to do that, you have to cut out this lump from the skin. Now the problem is, this area there's not much skin, as you can see. So if you just cut, you have to cut at least, I will give a probably 5 millimeter margin, so that if it's cancerous, at least you cut the normal margin, so that the cancer cells would not be in there. If you cut too close, let's say you cut just below here, then you send it for histology. The report will say that there is cancer cells in the margin, which means you didn't cut off all the cancer cells. So for all practical purposes, we will assume that this is cancerous. So to operate, then in theory you're supposed to give a 5 millimeter margin, like that, 5 millimeter, or even 1 centimeter. If the lump is here, you can give a big margin, so that when you send to the lab, at least the skin, the normal skin is there with no cancer cells. But in this case, if we come back to here, you can see there's not much skin to stitch up. Now if you just cut a circle, you can stitch up like this. Yeah, then you can close up. You can close up by the circle, but there's a tension, because the dog will be stretching the elbow, and this is the tension area, so you can see that it will break, the stitch will break. So especially it is too close to the point of elbow. So now we have to do a Z-plasty. Now a Z-plasty, when is to extend the incision, as example here, so that when you have to do 1 incision here, and by right you should do 1 incision here behind here, which means that first of all you cut a circle, a margin, so you have a circular hole. Now just be careful, because this is the point of the elbow, so this part is very high tension. So when you cut too much, then you find that this part is very hard to close, because the dog will be moving. You see the elbow? So this part will break. So one Z is this way there. My sister had done one here, and the other one should be here, more or less parallel to this the first one, the top one, so that when you stitch up, the skin will come to this side, this skin will come to here, and this skin will come to this side. So there is space, that there is no tension, and it will heal without tension. So that's called Z-plasty. The Z being this part, there you see here. Now the other way is this way, is that? The other way is here, where you cut here, you cut extra area here, and then you cut here. Not too long if possible. Then here, hold this up. Then in this case, you close up this way. This come to here. This come to here. This side come to this side. And in the end, it still end up as a Z. End up as a Z because it's like that. It's a Z, you see? So this part will come to here. So we forget about here, like this. Now which way should we do? That is the question now. So before operation, you just check and see which is the area of high tension. So the area of high tension is normally where they bend the elbow there. Where they bend the elbow. This is the high tension area. So if they bend the elbow, then you cut here, then there's a high tension because this part is the movable part, you see. So when you stitch up this area, it will be difficult. So I would say that most likely I will do this way, on top here and here. So then I stitch up, and you have to see how the dog stand up. Can the dog stand up? Let's see how the dog stand up. Stand up. You see how the dog stand up? Come, you just want to stand. Okay, go up first. So the tension is up and down actually. The tension. So you see which side has more tension, whether the lateral side or the top and down vertical side. So normally the tension will be the horizontal side normally, because the dog will have to stretch. So most likely I will do this way. Okay, vertical side.